have been confirmed around the Mozambican port city of Beira, which was badly damaged when Cyclone Idai struck there. And that was 2 weeks ago, killing more than 700 people across Mozambique, Zimbabwe and Malawi. And we're going to cross over now to our reporter Njanji Chauke, who is in Mozambique and, of course, following up on those relief efforts and also the rebuilding that is taking place at this time. Njanji, good morning.
Good morning, Sakina.
So, Njanji, with regard to the relief efforts, we heard the international community appeals being made. And of course, here in South Africa as well, our international relations minister will be accompanying some CEOs and other organizations to actually bring some of that relief effort to the affected countries. But what's the situation like in Mozambique this morning?
The situation is still very sad for the many families who have lost their loved ones. We saw a lot of injured people, the survivors of Cyclone Idai. For the past few days, we've been flying over some of these flash points that have been hit hard by one of the worst cyclones to descend on the southern hemisphere. And you can see, all we could see is absolute devastation. You will recall that the communities here are very much reliant on agriculture, on farming. So their livelihood has also been destroyed, as they try to rebuild their lives. We also visited one of the areas where a group of farmers have come together to try and help the communities there. They've been distributing aid in partnership with NGOs such as Gift of the Givers and others. Earlier I heard you talking about the concern over cholera. Cholera cases have been reported. Figures are still being confirmed. Yesterday we also spoke to the Mozambique's Minister of Land and Rural Development, who said that the official death toll from the Mozambique side was standing at 448. That figure, obviously, it's feared could go up. A few weeks ago, we had President Philip Nyusi saying that they are fearing that as many as 1,000 people could have been killed, Sakina. Today, one of the big stories, obviously, that expected visit by a high-powered South African delegation made of the International Relations and Cooperation Minister, as well as some top business people from South Africa who will be coming here to Mozambique to get a briefing and also to announce the kind of donation that is coming from South Africa.
And Njanji, we also know the port city of Beira was, of course, devastated. But, of course, you are there with Imtiaz Suleiman. So what have you been doing thus far?
Yeah, it's shocking to see how powerful nature is and the kind of destruction that it can cause here on Earth. Flying over Beira, going to the hotspots every time, it's shocking to see huge refineries from the skies looking like pieces of tin. You see big trees, strong big trees, the baobabs, looking like pieces of leaves. That should tell you about what really happened here and how powerful these waters were, and also how powerful this tropical cyclone was. But joining me now to talk a bit more about humanitarian aid here in southern Mozambique is Dr. Imtiaz Suleiman of Gift of the Givers. Dr. Suleiman, you, together with Gift of the Givers, you activated a swift response into Mozambique since day one. Tell us about what you have done so far in summary.
Well, it was, we looked at a response at multi-levels. One is we sent a rescue team to the airport to fly on helicopters to do water rescue. We sent a road team or a boat team towards Valanquilos to take boats and see who they can help in the water and take people out of water and take them from higher ground to, from lower ground to higher ground. The boats were then used also to ferry food because many of the roads were cut off and people couldn't get there. And helicopters couldn't, there were not enough helicopters to take food, and there still aren't enough helicopters to take people to the different areas. So the boat teams rescued people as well as taking food to the people, and now even taking medical teams to the different areas. The expansion of the program was then to bring a medical team, and the medical team has been very, very active. There was a medical team in the first component of 40 people that came, but we didn't bring many, simply because of the absence of helicopters. So to deploy people will become very, very difficult. But now we're using boats. We've got 4 of our own helicopters, and the Defence Force got 3 helicopters. So between us, we have 7 helicopters to take medical teams to islands or to grounds where the roads are not possible, to make food drop-offs for medical evacuation. This morning, unfortunately, very sadly, they found a child that's blind and a child that is deaf, affected by the cyclone. I'm not sure how, but we'll have those children evacuated on our helicopters within the next 1 hour, brought to the city. We're also helping the Mozambican Health Ministry. They've got the same problem. They don't have helicopters. So we put helicopters at their disposal to take their medical teams and to take medicines to the different clinics in the area. So that, and of course, we've already distributed 50 tons of food. We've given out blankets, bottled water, and seen over 1,500 patients already.
Okay. Sakina, there you have it from Dr. Imtiaz Suleiman of Gift of the Givers, giving you a summary of what they've done since day one of the disaster. We will be bringing you more details as and when it happens from here in Mozambique, as we expect that high-powered delegation from South Africa to descend here on Mozambique. They will then be proceeding to Zimbabwe. As you know, that Zimbabwe has also been hit hard by Tropical Cyclone Idai, but they will also be announcing donations towards humanitarian assistance in Malawi as well, Sakina.
Well, thank you so much, Njanji Chauke in Mozambique there. And as you heard, waiting that high-power delegation. But I think once again, one's faith in humanity restored, because South Africans have once again opened their hearts and their wallets to help those in need.